This is the chiropractic medical team. So you do want a medical team for your case. Let me go into what that means and what it all entails. What it does not entail is hiring medical people. That is, when I say that, people go, oh, you got to hire medical? No. Matter of fact, that's like a nightmare to hire medical people. It's one of the worst things you can do, okay? So I'm talking about referral sources. So when I'm talking about a medical team, I'm talking about referral sources. But this is what you want to do, this is who you want on your team, and this is how you want to get them on your team, and this is why they're important, okay? So why you need a medical team is patient health care. Obviously for patient health care. So many chiropractors try to do everything on their own, and it's one of the worst things you can do from a patient care standpoint, but also from a personal injury, authoritative standpoint, and credibility standpoint. One of the worst things attorneys don't like is, I call it the lone cowboy. It's when the chiropractor tries to be everything. And then, so there's no other authoritative professionals on the case. And it's not only bad clinically, it's bad authoritatively, and attorneys also don't like it. So medical team supports the financial drivers, and the medical team supports credibility in court. Now, there's additional considerations for your medical team and common soft tissue spinal injuries: pain, anti-inflammatory, muscle relaxers, anxiety, trigger point injections, large joint injections. You can't be a chiropractic nut. You can't be a chiropractic subluxation nut and not think anybody needs medication. Okay, you can't be like that. This is the real world. You're in front of real jurors, real people that take medication, So, pain for medication, even if it's temporary anti-inflammatories, muscle relaxers, anxiety, trigger point injections if needed, large joints, those are all supportive. So, there's nothing wrong with, in that initial phase of care, you doing your workup, you doing your anti-inflammatories and having a relationship where you send them over and they can get some prescription muscle relaxers or pain pills if that's warranted and needed, if it's that much of a problem. And it also significantly helps the case. So the typical chiropractic patients, remember, the soft tissue injury is 87% of the injuries, the disc is 32%, the nerve injury is 16%, the concussion is 10%, and the fracture is 2%. So remembering this, in other words, you need other providers. You need other providers for these injuries. So here's the 6 medical team members that I suggest you have as referral sources. Number 1 is pain management. That's the very first person that I want, is pain management. I'm going to use him the most because of the soft tissue injury. And I'm going to use him for initial medication, trigger points or joint injections, anti-anxiety, muscle relaxers, things like that, especially only in the first phase of in the pain and inflammatory phase. That's normal health care, okay? Now, obviously, that's not good to be taking some of these medications in the repair phase. Some of these medications, like the non-steroidal anti-inflammatories, I don't know if you guys know this, inhibit collagen synthesis. So they actually create problems when they're taking these medications in the repair phase. But, if you take them in the pain and inflammatory phase and for a short time, there's no big deal with that. The problem is that that's not what happens in the real world. The real world, medicine gives them pain and medicine for all 3 phases. That's the problem. So the orthopedic surgeon I like to use for extremities. Now I'm just telling you from experience. Orthopedic surgeons, they think of gross anatomy a little bit more. So I like to use them for extremities. I do not like to use them for spine. They're not as respectful and cordial to chiropractors, and they're not as sensitive as the neurosurgeon is to the spine and collagen. The neurosurgeon is the one I like for disc evaluation. So if I have a potential disc, it's the neurosurgeon that I want to get a second opinion. And one of the big things you'll hear me say all the time is you don't have to send them there for care. And that's a big mistake chiropractors make. You send them there for a second opinion. You just say, I'd like your opinion. I'd like your consult and your opinion on this disc. That's it. Let him do his professional work. So same with an NCV or EMG. Every time you send somebody somewhere, you don't have to send them for the test. You don't have to send them to the neurologist for the NCV. You send them, if they got radiating pain, say, I'd like your opinion. in regards to this patient's symptom of tingling and numbness in arm and hands? What would you suggest? See, you ask their opinion. You don't just, order the test particularly. And that's very helpful to the case, very authoritative and very helpful to the case, especially when you start developing relationships. Like the neurosurgeons, I could develop the relationships with the neurosurgeons, and I'll talk about that a little more in a second. But you know how powerful it is when you send them to the neurosurgeon, because most of them don't need surgery. So I just get the neurosurgeon, I got his okay, and he goes, the neurosurgeon says, surgery not required at this time, continue chiropractic care. You know how powerful that is? It's very powerful. It helps everybody. It helps the attorney, helps the chiropractor, creates authority with the patient. It helps everybody. The neurologist we use for nerve and electrodiagnostic evaluations. The neuropsychologist for mild concussions. Mild concussions, remember, are about 10% of the problems. You always want to look for them. We'll go into it. They're about 6% impairment rating. So I always want to look for it. But you will not find, one of the things I'm real good at is being a pragmatist. I'm real good at covering something and go, okay, how's this in the real world? Instead of blowing something up for an hour and then you never see it in your life. That's not how I work. So it's the same with concussions. You will not see in a small, low impact, soft tissue injury, you will not see a concussion or a CT or MRI. You just won't. Okay? So to get the findings for the concussion, we'll go into that. You want the neuropsychologist. When I cover that topic, we'll go into it more. And then, of course, the medical radiologist for x-rays. I hate to say it, but why do I want a medical radiologist and not a chiropractor radiologist? Credibility, guys. Credibility. Right? Thank you, subluxation. Credibility. So, those are the team members that we want and how we use them. And I'm just going to ask for their opinions. So if I have suspected disc, I'll send them off to my team member for his opinion on the neurosurgeon. If I have an extremity, elbow, knee, I'll send them off to the orthopedic surgeon for his opinion. If I have tingling and numbness, arm, shoulder, hand, I'll send them off to the neurologist for his opinion. You see how that works? That's how that works. Okay? Now, there's one big thing that makes it work. And you have to do this, or it doesn't work real well. So this is how you select your medical team members. In other words, you have got to get them on your side. One thing you never do, one thing you never want to do, and if you've been in practice any time at all, you already know this. You've already been burnt. Send a patient to a professional, another medical provider that you haven't established a relationship with. And what's the most common thing they'll do is they'll say, chiropractic's okay, but can you hold off on that for now? See, that's their new way of bashing chiropractic. Instead of saying, oh, chiropractic's blah, 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 don't go. They won't do that anymore because of lawsuits. Now they say, in my opinion, yeah, chiropractic's great, but why don't we hold off until you feel better? How ridiculous is that? Crazy stuff like that. So you can't just send your people to people you don't know. You got to get these team members lined up, and this is how you line them up. In other words, we straighten them up. We straighten them up. They're going to play ball with me, or I'm not going to refer to them. And this is how we make them play ball. So how do you get in? We're interested in referring you patients. You're interested in giving them business. That's how you get in, okay? You don't want anything from them. You want to give them something, okay? We're interested in referring you patients. You meet at their office. You don't want to have to meet anywhere else. You only want to introduce yourself. Everybody's busy. You try to schedule a meeting with, an hour meeting with an orthopedist, neurosurgeon, it's going to be next year if you get it. Everybody's busy. So you just want to stop by and introduce yourself. I just want 3 to 5 minutes. I just want to stop by and introduce. That's it. And it's typically not him you're talking to. It's his manager, office manager. The meeting only lasts 5 to 10 to 15 minutes. And I'm going to tell you exactly what you need to say. You do not ask for a long meeting. You do not ask for lunch. You would only like to stop by and introduce yourself. Have all your doctors and your marketing assistant attend. So your main players attend. If you got a marketing assistant, you should. They come with you because they're going to be interfacing with their office manager. If you have any other associate doctors, okay, you go there. They're not employees or subcontractors. They're safe referral sources. That's what they are, okay? So here's what you want to ask them. That's how you get in. Hey, I'm Dr. So-and-so. I'm looking for an orthopedist, neurosurgeon, whoever you're calling, to refer my patients to. I'd like to stop by and introduce myself, okay? Only takes about 3 to 5 minutes. When's a good time that I could stop by and introduce myself, okay? Ask 3 big questions. Number 1, what have you heard about chiropractic? Here's the 3 questions I'll ask. What have you heard about chiropractic? And all I'm looking for is to see if they have a lot of negative crap in their head. That's all I'm looking for. Here's what you're not going to get. I think chiropractic's wonderful. Everybody should get it so they don't have to get immunizations and vaccinations and their immune system gets better and helps fight cancer. That is not what you're going to get, okay? Here's what you're going to get. I think it's good on a limited basis, in some instances, infrequently, with some kinds of limited low back pain. That's what you're going to get. That's the little sliver of okay you're going to get, okay? All right? Now, agree. Here's the 2 things I get them to agree to. If they can't agree to these, I don't refer them business, and I just tell them up front. I say, I'll tell you what, I'll be glad to refer you business. I just have 2 requests. Number 1, when I send my patients to you, you don't take them off my schedule. Just like if you sent a patient to me, I would not take them off any of your schedule. That's exactly how I say it. Me and you. In other words, I say it as reciprocal like that. The second is, I don't want you to say anything negative about chiropractic to that patient. Just like if you sent a patient to me, I would never say anything negative about you or your profession. See, when I add them into it, how fair does it sound? It's an idiot question is what it is. It's an idiot question, okay? And then I shut up and listen. When I ask that question, I shut up. And I see if there's any animosity or if there's like crap. Any crap there, I don't deal with them. But if they're like, yeah, they're good for back pain. We work with chiropractors for periodic back pain and like that, fine. Will you expect any referrals from them? No. At this time, you won't. At this time, you won't. The only time, chiropractic, the profession itself, doesn't have the credibility to get cross referrals. Cross referrals only, I got cross referrals, but it had nothing to do with chiropractic. It had to do with me selling the neurosurgeons and him believing in me. Had nothing to do with chiropractic. In other words, he knew I wasn't a quack. He knew I wasn't a whack job. He knew I wasn't going to say all kinds of crap to his patients. He knew I was going to be responsible. And by the way, he also knew that I had a limited focus, that I treated neuromusculoskeletal spinal dysfunction based on the 3 phases of healing. And guess who's the one that taught him that? Me. So guess what happens when you actually teach these guys that your care is based on neuromusculoskeletal back pain, and it's based on the biomarkers relative to the 3 phases of healing, and then you explain the benefits of physical medicine in the repair phase of healing, neurologically and with the connective tissue. Wham! They are blown away. There is not one neurologist, neurosurgeon, orthopedist, radiologist that knew what the hell I was talking about. They had a vague idea, but the specificity at which I knew it and how chiropractic helped it, because they don't care about chiropractic. They don't care about the piezoelectric effect with physical medicine and the repair phase of healing and collagen type 3. They don't care about that. That's not their world. So when I'm explaining that stuff to them, it blows them away. And guess what they want? Medical providers want science. They want science. They don't want the hokey-pokey subluxation stuff. That's why you don't get referrals from medical providers, guys. That's why you don't, and you haven't for 100 years. So, agree not to take them off the treatment schedule. So that's how I get them, okay? That's how I get them to not bash me. Now, if they agree to these things, then this is what I'm going to ask for in addition. These are the supplemental questions. Would they be willing to see the referral within 24 hours? In other words, because it's me, and I'm going to give you regular business, is there any way I can get a patient in within 24 hours? Cut in front of the line. Well, would you do that if somebody was going to regularly send you business? Would you allow them to cut in line periodically? Yes. And this is exactly what I got. Would they be willing to give a second opinion? Very important. If I send you over here, would you be willing to give a second opinion? Would they be willing to support an ANA impairment rating? That was huge. I would do the impairment rating. I'd send it to my neurologist, my neurosurgeon. Say, can I have your second opinion on this impairment rating with this patient? Checked it right off and sent it back. Why did he do that? Because I educated him. I educated him on what I did, that my care was based on spinal problems, it was based on biometrics, and the whole care was based on the 3 phases of healing, and I explained physical medicine and how it helps in all 3 phases of healing, but more specifically the 4 negative aspects in the repair phase of healing. They love that stuff, especially the neurosurgeon. I told you, the neurosurgeon, remember 50% of the failed back surgeries are from scar tissue. So when you start talking about collagen, that neurosurgeon's eyes, they go wide. They like that. When you start talking about how you can affect collagen, decrease nerve entanglement, they love it. I got regular referrals every month from my neurosurgeon. Every month. And let me tell you, those are the easiest patients to process. If the neurosurgeon says go to the chiropractor, you're God to that patient. You're not a chiropractor, you're God. I mean, there's no selling with that patient because they trust that neurosurgeon. So, would they be willing to support? Would they take a lien on the case? A lot of times they don't. But these are the secondary questions you want to ask them. These are the personal injury. These are the personal injury type questions. Now, how can you find these providers? I'll tell you the easiest way. Your local MRI center. They network with all these people that do PI and send them MRIs for disc and injuries. They know all the players who are willing to do PI and the players who are chiropractic friendly. Contact the local MRI people and check with the reps and ask them which of these categories of providers have they found to be most friendly with chiropractic, and that's how. Otherwise, it's a cold call. You get in your book and you see who's in your area and you call them directly and you go to the meeting. I'll tell you a couple stories about that here in just a second. So these are the same medical team members that you will follow up with to create referral sources. So this is my marketing system that I teach how to get referrals from medical doctors. The first thing is you go to them to give them something. We set them up. Then we come back and we do the education on the 3 phases of healing, and wham, that's when the business comes this way. Never ask for referrals on the first visit. Don't go there asking for referrals. Don't go there with your hand out. I got to tell you, I play hardball. When I go in there, I play hardball with those guys. When I say hardball, what am I talking about? When I say hardball, I'm giving them something. I am not kissing their butt. Here's my criteria. If you can handle my criteria, I'm going to give you something. I'm not going in there with the typical, knee shaking, afraid chiropractor with my hands out. That is not the relationship that happens here. Okay? There's many guys I fired, many orthopedists, more orthopedists. The neurosurgeons I found this to be wonderful. I found most more neurosurgeons are great. I don't know what the deal is, but I just found they're good people. Yeah, but the orthopedists are a pain in the ass, narcissistic, egocentric. I mean, they are just the biggest pain. I can't tell you how many orthopedists I walked into, and they all act all narcissistic and everything. And I'm like, nah, we're not doing business. I'm out of here. I'm like, you're not getting my business, buddy. Now, never ask for referrals. First visit, remember you're only looking for medical team members. True story. Now this happens when you're more influential. Now, when I was in my city, I was in a city of about 500,000. Well, I had 9 offices. Well, that's a whole nother story when you call attorneys or you call orthopedic office and you say, I've got 9 offices. We see 35,000 new patients a year. We'd like to come in and introduce ourselves. We're looking for an orthopedist to refer. But, well, I did that to the largest orthopedic group in the town. And we all show up. And it was just supposed to be a meet and greet, right? We showed up. They stopped everything. They stopped everything. There's like 9 or 12 doctors. All of them came in. They had they had a big like eating room area. I mean, this was a big orthopedic center. Spread of food everywhere. They were kissing our butt for that business. Little old chiropractor. You know what he said? We were talking. I literally remember he said the word ivory tower. He said, we can't be up in our ivory towers anymore the way the reimbursements are occurring. We've got to come down and deal with the people. I remember he said that. And that was 15 years ago. I'm like, yeah, you guys need business. So that's your medical team. How important is your medical team? It's unbelievably important. So when I have, a potential disc, refer it out, potential just ask for the consult. But one other thing I'll tell you. When a patient, like you'll treat a patient for a while, and let's say there's no improvement, right? And when the patient says, do you think I need a second opinion? What is the patient telling you? They need a second opinion. You try to talk them out of it or this or that, they'll cut you, they'll fire you, and they'll go to that second opinion. In other words, they're losing trust in you because what you're doing is not working as well as what they expect, okay? And I'll tell you what I do when that happens. That's like a red flag when a patient says that. As soon as the patient says that, I said, you're exactly right. Let's get a second opinion. I cut to the chase immediately because I want them going to my guy, not their guy, because I know what's their guy going to do to me. Yeah, he's going to trash me. He's going to take him out from under care. And so I say, yeah, you're exactly right. Let's get a second opinion. And I send him right over to my guy. And what's my guy been trained to do? Dr. Paul's great. Chiropractic's great. I don't think you need surgery. Head back to Dr. Paul. It's exactly how it happens.